Hey there, I'm Dr. Groulx. We're going to meet Crystal in just a moment. She is 28 weeks pregnant and she's been seeing me for some time. And what I'm going to do is I'm going to video what it looks like for a pregnant person to be adjusted by a chiropractor. There are 4 patterns of pain that are common with pregnancy, and I'm going to circle around at the end of this video to explain what those 4 patterns are and how they can be helped through chiropractic. Let's go meet Crystal. You got three of the 4 pain patterns. So you said you're 28 weeks, right?
That's right.
Okay. So just with, not with everyone, but with Crystal, how I normally start off is just by checking to see how well her pelvis is moving. And so I'm just going to get you to turn. Actually, cross your arms over your chest. Good. I can always remove. Any sciatic pains this week?
No.
Oh, you've been good. How are your headaches been?
I haven't had any for a few weeks.
Okay, awesome. So I'll get you to stand for a second, and I'm going to just prep the table. So this is the only table that you'll be able to, yeah, that makes room for your belly. So go ahead and lay on your tummy. Yep. Cool. So we're going to start off with is just checking to see how well her pelvis is moving in a seated position, and so now I'm going to do it from a laying down position. This is that uterine, that check to see if the uterine constraint and the round ligament restriction in the pelvis. So it's very simple actually. We just do a leg check like this, and what we're feeling for, if the pelvis is locked up one side or the other, one leg will give more resistance than the other. And Crystal, can you feel one side give more resistance than the other?
It feels this week like it's my...
Yeah, I agree.
Yeah,
it is the left side.
Usually it's the other side.
Yeah, so the left side's not moving as well, so that's a big clue. That's a big clue that the left side is more stuck than the right side. So now, can you see the heels? Mm-hmm. So now what I'm going to do is to see if there's a difference in her legs. And this is a functional leg length inequality. I'm not implying that necessarily that her one leg is anatomically shorter, but it can be functionally shorter. So if the hips are locked up, one leg can appear shorter or longer than the other. And right now it's showing that the left side is actually shorter. Okay, that's good. So now these tables they're pneumatic, which means it's like adjusting her on a cushion of air. I don't know if it feels like that all the time, but good. And I'll recheck to see if the legs have evened out. And when I look down here, I check and double check. So the left one was longer, and now it's showing that it's even. That's good. Good. I'll bring you up again. Let's see if that left leg still feels more resistant than the right. See, that feels more even to me. How about you? Yeah, good. Good, I'm glad. I like when you agree. All right. Just going to roll your head gently like this. Nice. Okay. Wave to the camera. All right, awesome. Okay, so that was Crystal. And there are 4 actual pain patterns that can affect people who are pregnant. And Crystal, actually, she has 3 of the 4. So the first pain pattern is your generic back pain that can be right down around the lower back. It can even go up as high as the bra line. It might go across from one side to the other. It may favor the left side over the right side, and that's uncomplicated. It doesn't shoot down your legs. The second pain pattern is when it shoots down your legs, and we call that sciatica. It's very common in pregnancy, and that can be just as a result of all the extra weight that's being carried, it's pulled forward, and it's putting some extra pressure on your spine. Both of them respond really well to chiropractic care. So I backed up a little bit for you to see the third pain pattern. Like I said, the first 2 pain patterns are pains that are in the back. The last 2 pain patterns are pains in the front. And there's something called the round ligament, which plays a huge role in supporting the uterus. And as the baby grows, the uterus gets bigger, this round ligament can come under quite a bit of tension, especially if there's misalignment in the pelvis. And so what that can create when that round ligament is under tension, it can create pains in the front. Very often just underneath your tummy, right down into the groin is where you might feel that. And by adjusting the pelvis, that can take some of the torque off the round ligament and relieve a lot of that pain. The last type of pain is called symphysis pubis pain. Sometimes you can hear it called symphysis pubis or pubis symphysis. So what that is where your pelvis comes together and is joined by a very hard ligament right below the bladder. And where you'll feel that pain is when you're getting in and out of bed, or anytime you need to move your legs one apart from the other, and you get this sudden burning pain right below your bladder. That's coming from that very strong ligament that's holding your pelvis together. It's actually loosening because of that hormone called relaxin that's preparing the pelvis to be able to open so that the baby can get through the birth canal. Well, sometimes when this happens, that pubic symphysis will start to separate, and it can be exquisitely painful. And it's very amenable to chiropractic care. I'm going to put another video in the comments section so that you can see what that adjustment looks like. It's very gentle, it works wonders, it can really increase the quality of life. All right, I hope you found that video helpful. Here's what I'd like you to do next. Share the video with people that you think might benefit, or tag them and so they can see the video and get the help that they need. The other thing you can do is if you have any questions, just put them in the comments sections and in the comments section below, and I will answer your questions. Have a great day, enjoy your week, and I'll talk to you soon.